Welcome to History with Herodotus, where we embark on a journey through the vast expanse of human experience, navigating the intricacies of the past to illuminate the present. Today, we find ourselves at the threshold of one of the most pivotal and devastating events in modern history: the 1918 influenza pandemic, a calamity that would claim millions of lives and forever alter the fabric of our world. The early 20th century was a time of great upheaval, with the world embroiled in the First World War. This conflict, which began in 1914 and would eventually draw in many of the major powers of the era, created an environment ripe for the spread of disease. Soldiers, mobilized from their homes and concentrated in vast numbers in trenches and camps, formed a perfect vector for the transmission of pathogens. In the years leading up to the pandemic, the world was already experiencing significant social, economic, and political changes. The empires of old were crumbling, and new nations were rising from their ashes. It was an era marked by hope and despair, as humanity struggled to redefine itself in the face of unprecedented technological advancements and global interconnectedness. The spring of 1918 found the world at war, with the trenches of Europe bearing witness to some of the most brutal fighting in human history. It was amidst this chaos that the first whispers of a new threat began to emerge. In the military camps of the United States, where soldiers were preparing to ship out to the European front, reports started filtering in of a mysterious illness. This disease, which would eventually become known as the Spanish flu due to widespread press coverage in Spain, a neutral country during the war, and thus not subject to the same censorship as combatant nations, presented with symptoms that were at first dismissed as merely another outbreak of the common flu. However, it soon became clear that this was no ordinary influenza. The virus, later identified as H1N1, was particularly virulent, spreading rapidly among the densely packed military populations and then beyond into the civilian world. Its impact was exacerbated by the war effort itself. Soldiers moving across the globe acted as unwitting carriers, transporting the disease to every corner of the earth. The initial outbreaks in the United States, notably in Kansas and New York, were followed by similar reports from Europe, where the condition of troops on all sides of the conflict began to deteriorate rapidly. The virus did not discriminate. It struck down soldiers and civilians alike, regardless of age or health. This was a disease unlike any seen before, with its rapid onset, severe symptoms, and unusually high mortality rate among young adults, a demographic typically less susceptible to flu. As the pandemic spread, cities were brought to their knees. Public gatherings were banned, schools and theaters closed, and mask wearing became mandatory in many places. The medical community, already strained by the demands of war, found itself overwhelmed by the sheer scale of the disaster unfolding before it. Doctors and nurses worked tirelessly, often at great personal risk, to care for the sick, but their efforts were hindered by a lack of understanding about the disease and its spread. The 1918 influenza pandemic would go on to claim more lives than the Great War itself, leaving in its wake a trail of devastation that would take years to overcome. It was an event that would forever change our understanding of public health, international cooperation, and the enduring power of nature over human ingenuity. As the pandemic deepened its grip on humanity, the autumn of 1918 proved to be a particularly dire season. By September, the virus had spread to nearly every corner of the globe, with reports of outbreaks emerging from Africa, Asia, and South America. The city of Philadelphia in the United States was among the hardest hit, with over 20,000 cases reported in a single week. The medical infrastructure, already strained, began to collapse under the sheer weight of the afflicted, with hospitals overflowing and makeshift facilities erected in schools, churches, and even outdoor tents. In Europe, the war-weary populations were dealt a cruel blow as the pandemic struck with unrelenting ferocity. In Britain, King George V himself fell ill, though he would eventually recover. The British government, in an effort to stem the tide of the disease, launched a series of public awareness campaigns, urging citizens to avoid crowded areas, cover their mouths when coughing, and maintain strict hygiene standards. Similar measures were undertaken in France, where the pandemic had claimed the lives of thousands, including many prominent artists and intellectuals. One of the most striking aspects of the 1918 pandemic was its disproportionate impact on young adults, a demographic typically less susceptible to influenza. This phenomenon, which would later be attributed to a phenomenon known as cytokine storm, saw the immune systems of otherwise healthy individuals overreacting to the virus, leading to catastrophic inflammation and respiratory failure. The result was a staggering number of deaths among people in their 20s and 30s, a tragedy that would have far-reaching consequences for families, communities, and society as a whole. As the pandemic raged on, economies began to feel the strain, with trade and commerce grinding to a halt in many parts of the world. In India, where the virus had spread rapidly along the country's extensive rail network, the economy was particularly hard hit, with widespread shortages of food and medicine reported. The Indian government, struggling to cope with the crisis, eventually turned to the British colonial authorities for assistance, marking one of the rare instances of cooperation between the two during this period. By October 1918, the pandemic had reached its peak, with an estimated 195,000 cases reported in the United States alone. The city of New York, where the virus had first appeared several months earlier, was now a shadow of its former self, with empty streets, closed businesses, and a pervasive sense of fear hanging over the population. It was during this dark time that a young nurse named Helen Hayes would write to her sister, "I am so tired, I can hardly keep my eyes open, but I must go on, for there is no one else to care for these poor souls." As the pandemic slowly began to recede, the world was left to survey the devastation. In Australia, where the virus had arrived relatively late thanks to the country's stringent quarantine measures, the impact was still significant, with over 12,000 deaths reported. In Canada, the pandemic had claimed the lives of over 50,000 people, with many more affected by the economic and social disruption it had caused. As the pandemic slowly began to recede, the world was left to survey the devastation. The estimated global death toll ranged from 50 million to 100 million people, with some areas experiencing mortality rates as high as 20%. The social and economic fabric of communities had been severely strained, with many families losing multiple members and businesses struggling to recover. In the United States, for example, the life insurance industry paid out over $1 billion in claims, a staggering sum at the time. One of the most significant later events in the pandemic's history was the discovery of the virus responsible for the outbreak. In 1933, Wilson Smith, a British scientist, isolated and identified the H1N1 influenza, a virus which would later be confirmed as the cause of the 1918 pandemic. This breakthrough marked a major milestone in the field of virology and paved the way for future research into infectious diseases. As the years passed, the world began to rebuild and recover from the trauma inflicted by the pandemic. However, the legacy of the 1918 influenza pandemic continued to shape public health policy and medical practice. The pandemic had highlighted the importance of global cooperation in responding to infectious disease outbreaks, leading to the establishment of the World Health Organization (WHO) in 1948. The WHO would go on to play a critical role in coordinating international responses to future pandemics, including the SARS outbreak in 2003 and the COVID-19 pandemic in 2020. Today, the 1918 influenza pandemic is remembered as one of the deadliest natural disasters in human history. As historian Alfred Crosby once observed, the flu pandemic of 1918 was a traumatic event that changed the course of world history, but it has been largely forgotten. Despite this relative lack of attention, the pandemic's impact on modern society cannot be overstated. It led to significant advances in medical research, public health infrastructure, and global cooperation, all of which have saved countless lives over the years. The 1918 influenza pandemic also had a profound influence on the arts and culture. Many writers, artists, and musicians were inspired by the tragedy and chaos they witnessed during this period. For example, the pandemic is said to have influenced the work of authors like Catherine Ann Porter and Thomas Wolfe, who wrote about the devastating effects of the outbreak in their fiction. In conclusion, the 1918 influenza pandemic was a pivotal event in modern history, one that had far-reaching consequences for public health, medicine, and global society. The legacy of the 1918 pandemic continues to shape our world today. serving as a powerful reminder of the enduring power of nature and the importance of human resilience. That's all for today's History with Herodotus. Remember to like, share, and subscribe, and until next time, remember that, to understand the present, we must first understand the past.